Hello and welcome to At the Leadership Table with retired Major General Jim Hoyer. Oftentimes people hear the word leader and they think only of political leaders, but leaders come in many forms, and that's worth exploring. I'm Jim Hoyer, born and raised in West Virginia, a husband, a father, a new grandfather, and a retired military leader, serving for over 40 years in public leadership for our state and nation. Now, the most important mission I have going forward is to educate, motivate, and empower our next generation of leaders. At the leadership table with us today is Dan Dushanko. Dan is the Executive Director of the Monongalia County Emergency Medical Services. Dan has a long career in emergency medicine, 2 decades plus as a paramedic captain, a registered nurse, patient safety advocate, and more. He has been recognized nationally, including receiving the International Association of Fire Chiefs Chief Sandy Davis Health and Safety Officer of the Year Award. And Dan, first, I want to thank you for your dedicated service to people of West Virginia and Monongalia County, and thank you for joining us at the leadership table today.
Thank you, sir, for the invitation. I'm excited to be here to speak about leadership and, most importantly, community resilience and Monongalia EMS.
Very good. So, Dan, I'm going to start out by asking you the same first question we ask all of our guests. Please share with us a standout moment when you learned something really important about leadership.
Sure. Boy, that question takes me back. The example I'm going to give, sadly, was a result of a tragedy. So, as you mentioned in my intro, I retired from the Baltimore, Washington metro area. I was a paramedic captain, retired from there a few years ago. And 2018, July 23rd, 2018 to be exact, everything I thought I knew about leadership and being an officer changed that night. Our department suffered its first line of duty death, and it occurred at a residential structure fire. It occurred, at the time I was a captain assigned to a different engine company, but I had spent the previous 10 years at that station. The member that was killed, his name was Nathan Flynn. Nathan was a friend of mine. He was assigned to the company that I was previously at for about 10 years. I was on my company and my crew was on the rescue team that rescued and recovered Nathan. Participated in resuscitation efforts. Unfortunately, Nathan did not survive the injuries that night. The next day, I was assigned a 1-year assignment to conduct an internal investigation and write a report, a root cause analysis, not the proximate cause. We largely knew in pretty short orders of what the events that happened, but how did the organization get to that point? I spent a year of my life with some other colleagues and met some of the best and brightest in the fire service and public safety arena around the country, sadly for all the wrong reasons, right? What I preach now to my young officers, my captains, my lieutenants, is that in a leadership role, no matter where in the organization you are, from lowest level company officer up to the executive director, right? I always tell them it matters. And what's the it? It's everything you do, right? It's every decision you make. It's the words you say, how you say them, how you communicate them, your actions. Your members that you are leading are always watching. And if there was one point that came out through hundreds and hundreds of hours of interviews after that line of duty death, was the members were telling us that they would allude back to lessons they learned from their officers throughout their careers, and some of these were 30-year veterans in the fire service, and they were talking about Captain so-and-so or Chief so-and-so and Lieutenant so-and-so, and he used to say this and he used to say that, and we would do this and we would do that. And now, when I talk to my officers, and even in this position, I think every single thing that we do, it sticks and it matters. Those decisions, some of those decisions are relatively quick and easy. Some of them take more time, right? And the downstream impacts of your actions and words and decisions as a leader will at some point play out in the organization, right, and play out in the operation. And so if there's one thing I instill, it's to be mindful, to be thoughtful, to be always present, to never take that opportunity to lead for granted, right? Like they're always watching.
And I think your example highlights two important aspects of leadership. One is sometimes you have to lead in tragedy and difficult circumstances. And number two is that you also have to move the organization forward from tragedy as well, right?
Yeah, that writing that report, obviously we looked at, there was some missteps and some, it's a Swiss cheese model of accidents, right? And so we discussed those in the report, but the report was largely written, as an action plan for years, potentially decades, right, of training, strategy, tactics, officer development, crew integrity, skill set. And that was the way that we, as leaders writing that report, we wrote it as a roadmap, right? And I stay very in touch with the leadership there in that department, and I have a lot of friends that still work there. And if there's one thing that gives me some comfort at night, is knowing that the organization is going through that plan, systematically, like piece by piece by piece, in implementing the recommended changes. And some of those changes, a cultural change, right? A cultural change in an organization doesn't happen in a few years, right? It takes almost a whole generation to change the culture of an organization. But I think if that was the one thing that I contributed to that organization, was giving them a roadmap to hopefully never have that event happen again.
So I notice you and I have several things in common. One of those is we are both retirement failures. So I think it's important for our listeners to understand a little bit more about your experience in large metro area, your nursing background, and how you got to Mon EMS. So tell us a little bit about that background.
Sure. So it kind of, I feel like life has come a little full circle. I grew up in Northeast Pennsylvania, small town, 4,000 people in my town, right? And I started volunteering. I wanted to be a firefighter, paramedic since I was a little boy, right? And I started volunteering at 14 years old in a junior cadet program in the town volunteer fire department. And so that was where I got my roots, right? A hometown, middle America. The town didn't have a traffic light, right? And I got my EMT, firefighter certifications, went to school, graduated as a nurse, worked in an ICU setting in Northeast Pennsylvania, decided I wanted to go to public safety. So went to Howard County, Maryland Fire and Rescue, which is just south of Baltimore, just north of DC. Worked a full career there, everything a metropolitan area can offer, right? And in the time frame this was happening, was pre and then during the 9/11 era, right? And I was involved in special operations. So you can imagine Baltimore, Washington metro area special operations post 9/11. The world changed that day,
right.
And I'm sure in your career you experienced all of that in the military, in public safety, and protecting the national capital region, and the infrastructure and the developments and the training and the skill set and the equipment and everything that went on in those years. Did a full career there, retired. My wife and I, we moved to Deep Creek, so we went back to middle America, right, to the mountains of western Maryland, and realized I missed it. I was probably retired too young, right? And so here I am at Mon EMS, and I think that the best part of this now is that the Baltimore, Washington metro area has so much resources and so much infrastructure, and I'm trying to, scope and scale. I would say that it's scope and scale. Try to bring the best pieces and parts of those systems and bring them here to Monongalia County. It's a different scope. It's a different scale. It's a different funding system. But you can pick and choose the best pieces and parts and plug them in here. And that's been the mission for the last 16 months.
And I think even those of us that are born and raised in West Virginia, when we think about Monongalia County, or Mon County as we refer to it, we think about more of a metro area with WVU and that piece, but you've got a broad spectrum of responsibility, your team, in that you could potentially have, on any given day, you have what's the equivalent of the largest city in the state when
Right.
WVU football is playing a home game and the stadium's full. But if you go out to the western part of the county, you've got pretty rural areas with limited comms. So talk about day in the life of Mon EMS and all the various challenges that you guys face.
Yeah, so to think about, Monongalia County, 366 square miles, 105,000 people, not counting the university population. And to your point, athletics, it'll swell to the largest city in the state. Mon EMS, we are the primary 911 response agency for Monongalia County. The 911 emergency request side is about 20,000 calls a year. Right? That's 20,000 calls from downtown Morgantown to the furthest reaches of the West region, which is 45 minutes from the city. To your point, it is long travel times. It is 45, 50, 60 minutes with a patient, limited communication abilities, and really not much in the way of resources other than our EMS unit that's stationed at the Blacksville Volunteer Fire Department. That's Mon EMS on the 911 side, right? Everything event medicine has to offer with football, baseball, basketball, all the sporting events, the mass gathering events here in town. And then the other side of Mon EMS that some people don't realize is that we offer and do interfacility transports for our partner hospitals and both Vandalia, Mon General, and West Virginia University Medicine, JW Ruby. So that accounts for another 5,000 transports a year that we interact with patients. That might be taking patients from one hospital to another hospital for higher level of care or specialty care. That might be accessing to psychiatric facilities, rehab facilities, nursing homes, taking patients that have mobility issues home, right? Getting discharged from the hospital and they need help getting in their home. So our skill set from our clinicians, has to be everything from operating downtown at 2 a.m. after a football game win to operating completely alone with no communications in the far west of the county on an emergency basis, and then it's a non-emergency transport to take a patient. And I always use the example to our clinicians, taking a patient home to hospice care. Think about the impact that you're making and the decision that patient or that family has just made. It's a totally different mindset from a 911 emergency call to the hospice patient, right? So from an agency perspective, we are very dynamic. And the skill set for our clinicians, I always tell them, I tell the young providers, you'll work in Morgantown for a while, and then you're going to Blacksville, because it's a different skill set, right?
And do you see, because Ruby is the primary level 1 trauma center in the state, but also regionally, because when you think of Greene and Fayette County and over into western Maryland, WVU is a medicine and Ruby is a regional level 1 trauma center. How does that impact you guys coordinating and helping other departments coming in and bringing in patients?
It does. So, interestingly, we stood up our whole blood, pre-hospital whole blood program last May. So we're the third in the state and one of less than 50 agencies in the entire country. Now, if you think about that, the entire country, there's less than 50 whole blood agencies in the country. And we trained our clinicians and prepared to administer blood here in Mon County. And where was our first administration? On the interstate in Garrett County, Maryland. of all the things that we did not plan for and did not train for was the act of doing it. It was just some administrative issues of being not only out of county, out of state, but we serve this catchment area for Ruby, for its specialty center is massive. Just last night we went to Fairmont 3 times, to Fairmont Hospital, to go get patients that needed life-saving measures to get here to Ruby. So 3 times last night we went there.
Yeah, and I want to pull on that a little bit. And the whole blood piece is something probably listeners don't know a whole lot about, but it goes to a question about how you guys have been kind of on the cutting edge of a lot of technology implementation. So let's talk about the whole blood piece a little bit more, and then we'll talk about how you integrate that technology into leadership and training with this younger group of paramedics you're bringing in.
Yeah. So, Mon EMS is very fortunate to be partnered with two world-class health organizations. We have Monongalia, we have WVU Medicine. The research and the data, shows, and it came, from your experience, from the military, right? The whole blood in the field. We know whole blood saves lives, right? And the research is compelling. And we were poised with our partnerships with WVU Medicine to be able to deploy here. We recognize the need, the travel times, right? And it's not just Mon County. We're treating patients from Marion County, from Wetzel County, from Greene County. That life-saving interventions. And we've been doing a lot of research and watching the data to see the patient outcomes, right? And watching patients that were very unstable and hemodynamically unstable from trauma or medical events, an hour plus away from the hospital, and getting whole blood therapy in the field and watching their vital signs and their clinical presentation improve greatly by the time we got them to the hospital.
And to the point you made earlier, for somebody from Garrett County, Maryland, or Greene or Fayette County, Pennsylvania, you guys could be the difference between life and death, because to get to a larger center from Garrett to go back east or to get north into Pittsburgh is not the direction that those patients are going to be able to go.
Right, and we're honored. We're honored. We're very fortunate to have the relationship we have with WVU Medicine and the blood bank there and the blood program. And again, our mission is to save lives. Right, that's what we do. We treat patients, and we do that without concern for boundaries. Right, if Garrett County calls and says they need blood, they need blood. There's a patient in need, and we go and we treat the patient, and then that is what we do.
So you mentioned to me earlier too, before we got started, that you guys are involved in another pretty cutting edge piece, and that is this emergency medicine fellows program you're going to be working with WVU Medicine on. Talk a little bit about that program, but also how it helps make you better as an organization and a department.
Sure. So West Virginia University Medicine, is standing up an emergency medicine fellowship for these are already, board certified physicians that are now doing an emergency medicine fellowship. Mon EMS, is partnering in that program. Those physicians have skill sets and things they need to accomplish during their fellowship, teaching, training, mentoring, working in the community, right? Well, we have a captive audience of clinicians that are just eager for interaction and training and education. So that partnership is very beneficial to both entities, right? The physicians are getting training in emergency medicine management and system management. So they help us with everything, obviously, from education to quality improvement and quality assurance, right? To community medicine. They will be at WVU football, right? They will be out in community events. They have a response vehicle that they actually respond in the pre-hospital environment in Mon County. So there's the community here may see a emergency package vehicle that says EMS physician on it, right? A physician will come to your living room and treat the patient, and those physicians will get on a Mon EMS unit, right? And how much better care can you get than a very well-skilled and trained EMS clinician, and then an EMS fellow physician in the back of your ambulance in the community.
And that can potentially help reduce the overburden that occurs a lot of times in the ERs, right? Yeah. It reduces that need for throughput sometimes.
Yeah, I think in the future, and that's you see that model happening across the country and in the major metropolitan areas where you're seeing more advanced practice practitioners, whether it's physicians assistants, or nurse practitioners out in the field assisting triage assessments, guiding treatment, therapy, transport decisions, triage decisions, to speed up that to definitive care, as well as triage out to lesser care to unclog the emergency rooms, right? The emergency rooms, for a lot of people, that's their first access to care, but may not be the most efficient use of access, right? So I think that will be one of the things that Mon EMS will venture down that road in the coming years, is using more advanced practitioners to guide care and triage decisions for the community.
So a lot of times I get frustrated because people outside of West Virginia think we're kind of backwards and we're last, and we do have some health challenges that get publicized nationally. But you made the point earlier, the whole blood program. There's only a handful of those across the country right now. So reinforce that point for our listeners, how many programs there are and how unique you guys are at doing that.
Yeah, there's less than 50 across the country. That's the entire country, right? And there are 3 here in the state of West Virginia. And it's interesting you say that. You make up a very interesting point. West Virginia's medical protocol, so our EMTs and our paramedics operate under a state protocol. The state protocol in the state of West Virginia is one of the most aggressive treatment protocol subsets in the country. Our EMTs are doing skills that are reserved strictly for paramedics in other states. The curriculum for EMTs in West Virginia, far exceeds the rest of the country. And I think some of that's driven by need and necessity, right? It's distance and travel time, to definitive care in some of the rural areas. And so we are very well poised in West Virginia, with the protocol, with the support of the state Office of Emergency Medical Services, and we maximize that in our education programs. Our education program is more than 3 times the national standard on classroom hours, because we want our clinicians here in Mon County to be well trained and well versed.
And that's probably really important to you from a leadership standpoint, because in Mon County, as we mentioned, you could, on any given sporting event, you could be in the largest city in the state of West Virginia, or you could be out in rural western part of this county responding to a mine accident. So you've got a broad spectrum to manage.
Broad spectrum. We train intensively. We make sure that our clinicians rotate through assignments so they're comfortable working in all of those different environments. We partnership closely with our health systems. And really, I believe we deliver, I will argue, one of the best EMS systems in the state of West Virginia.
And it's clear from listening to you and watching you that you are you're not just a former major metropolitan paramedic captain. You're not just a nurse. You're not just the head of Mon EMS, but you're a strategic thinker going forward. So tell me a little bit about what you envision for the next 5 years for Mon EMS and where you want to go and be.
Yeah, I think the next 5 years will be. We've done a tremendous amount of work here in the last year with the whole blood program. That the next step, we've really spent a lot of time building our educational foundation for our workforce. Now I think the next steps are maximizing some technologies. So we are in the process right now. July 1st, we will launch a brand new patient care reporting software. It'll be the first in the state of West Virginia. It's heavily involved in the artificial intelligence, right, to drive more efficient patient care, safer patient care. One of the we've partnered one of the first agencies in the country to use a medication cross-check via an app. So when I put the patient information into an app and say that I'm going to give an albuterol treatment, a breathing treatment, right? This app on our device will it will know the patient and the patient age. We'll put that in, and it'll take a picture of the medication, and it'll confirm that that's the medication that is due for this patient. It'll tell you that is the right dose, and it's just it's a cross check for our clinicians to be certain that we are being safe for safe patient care. I think the next 5 years as well is our recruitment and retention efforts have to ramp up. It's not lost on me. We're a college town. Right? Everybody knows that, right? And our workforce is young. I mean, it's a lot of young 20-somethings, right? That are all in school, and they're here to better themselves, right? They enjoy their time at Mon EMS and the education and the background and the experience they get. But they go on to nursing school. They're pre-med. They're in med school, right? And it's great to watch these young adults better themselves and better their education, and then they move on. right? So right now I'm trying to build out a system. This past November, December, we launched the lieutenant position. So now on shift, there's a lieutenant and a captain. We've augmented the field training officer position. We're trying to make a career path, right? So what I want the goal to be at Mon EMS is not a stepping stone agency, right? I want to build from the EMT Academy, where they come in as young adults, get trained as EMTs. The goal in the next 24 months is to stand up our own internal paramedic program, to train internally our own paramedics and become a nationally accredited paramedic training institution, to make paramedics, train them to be field training officers. A few years later, they train and they become lieutenants to captains, captain to a director level, right? And we're well poised with that. Our relationship with the university is phenomenal, right? The educational opportunities here at the university and with WVU Medicine and the support of Monongalia Health, we are so well poised. We've identified all the pieces. Now I just need to put them together and get them all lumped together.
And do you also envision opportunities? You're an example of somebody who has balanced being a highly trained paramedic, but also a highly capable nurse. Do you see opportunities for people to do like you've done and balance two things together? And are there opportunities for people to also serve part-time or in volunteer roles?
Absolutely. So we have a part-time program as well as what we call a casual program, which has far less educational time commitment requirements. We have a number of employees now, and that's the conversation I have. I'm going to nurses. Well, you don't have to leave, right? You can still. I really miss doing that. Well, then why don't you stay? Why don't you stay and do a couple days a month, and still serve Mon EMS? And then that partnership. And those are the connections we're building now. What better? We have a clinician now that is a med student, is actually doing an internship this summer at Ruby. And, that, like I've mentioned to him, I'm like, there's educational opportunities, to come in and teach our clinicians, right? And what better way to give back to an agency, especially for the young members that got their start here, right? And it's interesting, the state medical director, Dr. P.S. Martin, who you may know.
I know P.S. well.
Dr. Martin, right? And he will tell you, a long time ago, Dr. Martin was a Mon EMS employee. So, what better way, to give back is to keep on moving up, right? But don't forget where you come from. And I always say that to all of my providers. I still have a picture. Again, I started in the early '90s in a small town in Pennsylvania, and when I moved away, they gave me a picture of the town fire engine, and with the label maker tape, it says, "Don't forget where you came from," right? And I always say that, like, I know where I started. I started in small town America with 20 members, a volunteer firehouse, in a town of 4,000 that went on 80 calls a year, right? But that's where I started, and that's what Middle America is, right? I've never forgotten that agency, the people that helped me, that mentored me, that trained me, that taught me, and I still go home and I still stop in, and they don't know. A lot of the young kids now don't know me, right? But that's where and I tell them the same story. This is where I started. I went on to a great career, but it all started right here, right, in this little 4,000 person town.
Yeah, and with that, I want to thank you, Dan, for your dedicated service, not just in small town PA, but in the Baltimore, Washington metro area, and now in Monongalia County. Your service and commitment to taking care of others is exceptional, and I thank you for joining us at the leadership table today.
Thank you for having me.
All right. Thank you.
Thank you.
Thanks for listening. This has been At the Leadership Table with retired Major General Jim Hoyer. Did you know you can now find me on social media at RMG Hoyer? That's HOYER, or email me at rmgjameshoyer@gmail.com.